Hello everybody, and welcome to the Thursday edition of Video Clips. And today we're going to talk about robotic surgery, which actually is not better and in some cases worse when it's used for cancer treatment. That might shock you a little bit. Many consumers and even doctors are not aware that devices are often not subject to review by the FDA before they're used in medical practice. Those devices which are approved often are used for procedures for which there was no review long after the devices are widely used. One loophole used to avoid regulatory scrutiny is for a manufacturer to claim that a new device is significantly like a device that's been on the market for a long time, and then there's no reason for it to be reviewed. Another is to just expand the use of a device without any studies required to prove efficacy or safety. For example, many of the robotic devices which are currently used for the treatment of cancer were never approved for this purpose, yet have been widely used for this purpose for the last 15 years. The assumptions are that, first of all, the devices must be safe for almost anything since they've been in use for a long time. And in the case of cancer surgery, the assumption is that less invasive is always better than more invasive, which on the surface sounds like it would be true, but as it turns out, not so much. Recently, the FDA has, in a rare moment where they actually did something on behalf of patients, so this is sort of a hallmark moment in my world here. Recently, the FDA has warned that not only is robotic surgery for cancer patients not better, in some cases it may lead to worse outcomes. In its report, the FDA cited two studies from the New England Journal of Medicine. In one clinical trial, cervical cancer patients who had minimally invasive surgeries, including robotic procedures, had 4 times as many recurrences of cancer and 6 times as many deaths than women who had open abdominal surgery. The trial was ended early because it was unethical to continue with the trial. The other study was funded by the National Institutes of Health, and it compared outcomes of 2,461 early-stage cervical cancer patients who had varying types of surgery as part of their treatment. 4 years later, after the surgery, 9.1% of those who had robotic surgery had died, as compared to 5.3% of women who had open abdominal surgery. The FDA's warning was not limited to cervical cancer and stated that robotic surgery is not approved for the prevention or treatment of any cancer. The agency also expressed concern about the training that doctors receive in order to perform the procedures, and I think there are some pretty good reasons to be concerned. So some of you have heard me talk about Richard Ablin. Dr. Richard Ablin, good friend of mine, has spoken at our conferences a couple of times. He's the researcher who discovered prostate-specific antigen, or PSA. He's also the author of The Great Prostate Hoax. For many years, he's been trying to convince the medical profession and government agencies that PSA is not a marker for cancer, that prostate cancer is overdiagnosed, and that many men are overtreated. Most men who have had a prostatectomy have been overtreated, according to Dr. Ablin, a situation that is made even more egregious due to the common use of robotic surgery. Intuitive Surgical introduced the Da Vinci surgical system in the year 2000 using, quote, pre-market notification as a means for avoiding clinical trials. The Da Vinci system, at a cost of as much as $2 million, was similar to other robotic systems already approved for urological procedures. It didn't take long for the device to be used for radical prostatectomy. Here's how Dr. Ablin describes prostatectomy using the Da Vinci robot in his book. The patient is placed on a tilted table with his feet above his head and his legs parted. The surgeon, who sits at a video control panel, makes 6 punctures in the abdomen, and carbon dioxide is pumped into the abdomen in order to distend it. A thin tube is placed into one of the incisions with a camera, which is held by a robotic arm. The other arms hold instruments. Using a foot pedal and toggle, the surgeon, along with surgical assistants, controls the arms and places them through the incisions. A clamp tool separates the prostate from the bladder using heat generated by high voltage to control the bleeding. Then a portion of the sperm ducts and seminal vesicles are removed. The prostate is separated from the rectum, and the urine channel at the tip of the prostate is divided. The prostate and seminal vesicles are placed in a plastic bag while still inside the patient, and the bag is removed by enlarging one of the incisions. The bladder and urine channel are sutured together, and a catheter is inserted through the penis into the bladder to drain urine. This procedure takes 3 to 4 hours. What type of training does it take to be able to perform such a delicate procedure? 1 hour of online training, watching 2 videos, and 7 hours practicing on pigs. Even more concerning is the surgery for which da Vinci was originally approved. The FDA approved it on the basis of one study performed by the manufacturer, which compared 132 patients who had traditional surgery with 113 who had the same surgery performed using the da Vinci unit. There was no difference between the groups. The surgery performed in this single study, gallbladder surgery, which is considerably less complex than what I just described to you. Most men choose the robotic procedure because they think the outcomes will be better. But an analysis of Medicare data for almost 9,000 men who had prostatectomies between the years 2003 and 2007 tells an entirely different story. Some of the men had minimally invasive surgery, while almost 7,000 of them had standard open prostatectomy. Those who had the robotic surgery left the hospital an average of 1 day sooner, and they had fewer blood transfusions. There was no difference in cancer recurrence rates between the two groups, but the men in the robotic group were more likely to have complications related to urinary incontinence and impotence. Another study concluded, quote, Medicare-age men should not expect fewer adverse effects following robotic surgery. The FDA claims that robotic systems like da Vinci are approved for use in practice based on the evaluation of the device as a surgical tool and not an evaluation of the devices for the treatment of cancer. An FDA spokesperson stated that the FDA does not regulate the practice of medicine and, quote, if a medical provider determines it's appropriate to use a product off-label, we don't regulate that. As for why doctors continue to recommend and perform these procedures, that's kind of a hard one to answer, isn't it? Well, first, doctors love shiny new things and often adopt new practices because they are, well, new. Doctors routinely do not do their own research, you heard me talking about this on Tuesday, and often rely on drug and device sales reps for information about how to treat patients. It's difficult to imagine that a practicing urologist checked out the da Vinci system before deciding to use it, because this would have revealed that no research on prostate cancer patients was ever performed with the device. I'd like to think that this might have made a difference if any of them had bothered to check it out. But there's another issue that's pervasive in medical practice, and it's almost a total lack of consideration for long-term outcomes for patients. Doctors routinely prescribe drugs that change biomarkers, but they don't improve long-term health outcomes. In the same vein, they perform robotic procedures because the recovery time is shorter and there's less pain, even though the long-term outcomes are worse. This short-sighted view of decision-making regarding medical care is increasingly concerning. New is not always better, and in many cases it's considerably worse. And while patients are not always able to articulate what they're looking for, they generally are not looking for short-term solutions and pretty blood work. They're looking for better long-term health outcomes. And if they don't start articulating that and judging the efficacy of some of the treatments that are recommended to them using that standard, they will continue to get hurt. So some of you men who've been diagnosed with a high PSA, remember it's not a marker for cancer, and remember if you do have prostate cancer and you're considering a prostatectomy, the robotic procedure does not lead to better outcomes. Well, that's all for today and all for the week. Hit the subscribe button as usual. Pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.